recording? Okay. Here is my blank health history form. Everything is clear. There's no comments on it. Okay, so I'm gonna knock. Hi, my name's Maddie. I'm going to be your student nurse today. How are you doing?
Doing good. How are you?
I'm doing well. I'm here to do a head-to-toe assessment on you. Is that okay?
Yeah.
Okay. First, can you give me your name and date of birth?
Drew Barrie, 5/29/02,
And then, what city are we in right now?
Midland, Michigan,
And what year is it?
2020.
Okay. So the patient is ANO times 3 because he's alert and oriented to all aspects of that test. Okay. I'm going to do brief health history on you. I apologize, there are some personal questions in here, and then we're going to move on to medical diagnosis and some medications. Sound good?
Mm-hmm.
Okay, so the first question is, how often do you smoke?
Not at all.
How often do you use drugs?
None.
How often do you use alcohol?
None.
How often do you engage in sexual activity?
None.
Okay. Do you have any past medical diagnoses that we should be aware of?
I don't.
Do you take any medications daily?
Claritin every day.
And what do you use that for?
For my allergies.
How long have you been using that?
A couple of years now.
Okay. So nothing concerning with that. Are you on any herbal medications or supplements?
No.
No vitamins?
No.
Okay. So next thing I'm going to ask you is, are you in any pain today? From 0 to 10 numerically, 0 being no pain and 10 being the worst pain you've ever felt, what would you rate your pain?
0.
0? Okay. Next thing I'm going to do is I'm going to inspect your hands. Just going to note that the skin looks normal. It is not cyanotic, or there's no sign of redness or swelling. There is no clubbing of the nails. The nails look normal, and capillary refill is good. It is less than 2 seconds. So at this point, I would take a set of vital signs. Normally, I would take his blood pressure, his temperature, and his SpO2, but I don't have that at home. So I'm going to take his pulse for a full minute. Okay, so his pulse was 62 and his respirations were 14. So those are both normal. They are both within their ranges. And the next thing that I'm going to do is I'm going to take a look at his arms. Okay, so the temperature is even throughout the arms. There is muscle tone and it is symmetrical throughout. I'm going to palpate the radial and brachial pulses for symmetry in both of the arms. The radial pulse is symmetrical in both arms. And so is the brachial pulse. It's symmetric in both arms. Okay, Drew, the next thing that I'm going to have you do is, can you do some range of motion with your shoulders, some swimmers? And then can you flex and extend at your elbows? Do you have any pain with that?
No.
Okay. The next thing that I'm going to do is, can I test your strength? Will you squeeze my fingers for me? Okay, good. Don't let me push in. Don't let me push out. Don't let me push down. Don't let me push up. Okay. This is checking the spinal accessory nerve, cranial nerve. Can you shrug up? Okay, good. And then while I'm here, I'm going to look at your tissue chirper. There is no tenting, so that is good. It is a good sign that the patient is correctly hydrated. Okay, now I am going to do, the next part is the head. So I'm going to take a look at his hair, inspect his hair, and then palpate his scalp. Okay. How often do you wash your hair?
Every day.
Every day. Is there any pain or tenderness when I touch your head?
Nope.
Nope. Okay. Everything's good with that. Now, just going to note that his head and face appear to be symmetrical. They are symmetrical. And then the next test I'm going to do is for the facial nerve. So, Drew, can you smile for me? Big smile. Frown. Angry face. And then puff your cheeks out. Okay? Everything looks normal with the facial nerve. Next thing I'm going to have you do is I'm going to touch your face. And then you're going to close your eyes. I'm going to touch your face. And then, for example, you would say right cheek. Okay, so close your eyes. This is also for the facial nerve.
Right cheek. Forehead. Chin.
Okay, the next test, I'm going to be testing the sensory part of the trigeminal nerve. So you can keep your eyes open. I'm going to touch his face with either the sharp or the dull side, and he's going to have to tell me if it's sharp or dull and where I am poking him.
Sharp forehead. Dull chin. Dull left cheek.
Okay, everything is good with that. The next thing I'm going to do is I'm going to move on to his eyes. For starters, I'm going to examine his sclera. So can you look down for me, Drew? Okay. Can you look up? Okay. The corners of his eyes are pink and moist, so that is good. That he's hydrated correctly. His sclera are white, and there's no sign of jaundice, so everything looks normal there. The next test that I'm going to do is on the oculomotor cranial nerve. So this is testing that the pupils are equal, round, reactive to light, and that they accommodate. So the first test I'm going to do is I'm going to shine this light in your eye, Drew, and then I'm going to watch for the pupil to constrict in that direct eye. Yep. Good. So both the left and right pupils both constricted fairly fast after the light was shined in the eye, so everything looks good there. The next test that I'm going to do is I'm going to put a hand over the nose and I'm going to shine the light in one eye and then observe the pupil constriction in the other. Everything looks good there as well. The last test for the oculomotor nerve is accommodation. So you're going to look at the pen, Drew, and then when I say look at the wall, you're going to look at the wall. Okay, wall. Everything also looks good there. The pupil's constricted, dilated, and then constricted, showing that there is accommodation there. Okay, the next thing that I'm going to do is I am going to check your ocular motor, your trochlear and abducens cranial nerves. So I'm going to do this with the 6 cardinal fields of gaze. So just follow my pen. Okay, everything looks good there. So now we're going to check the cerebellar function. So you're going to go nose to pen, nose to pen. Okay, everything looks normal there. And Drew, can you this is also for cerebellar functions. Looks good there. And then can you hit, if you can see, can you hit your legs, flip your hands over. Okay, everything looks good there. So now that I am done with that, the next part is his nose. So I'm going to note that. I'm going to palpate his frontal and maxillary sinuses first. Let me know if there's any pain with this, Drew. No pain?
No.
Okay. Next thing I'm going to do is I'm going to inspect his nose for symmetry. Everything looks symmetrical there. Can you lift up for me? Everything looks good inside the nose. The mucous membranes are pink and moist, so that is a good sign. The next thing that I'm gonna do is I'm gonna test his olfactory nerve. Olfactory nerve. So you're gonna close your eyes, and I'm going to put. You don't have to close them yet. I'm gonna put a scent in front of you, and you're gonna tell me what you think it is with your eyes closed. Okay.
Cinnamon.
It is cinnamon, so everything is good for that. Next part is mouth. I'm going to inspect his mouth, and that is the next part. The lips appear to be symmetrical, so everything looks good there. The first thing that I'm going to test is your hypoglossal cranial nerve. So can you stick out your tongue for me? Okay, good. His tongue looks symmetrical, and everything looks good there. Can you open up? I just inspected his oral mucosa. The mucous membranes are pink and moist, so that is good. Nothing, there's no lesions, no caries. Everything looks normal inside the mouth. The next thing I'm going to have you do, Drew, is can you clench your jaw? Okay? The jaw clench was testing the trigeminal cranial nerve. The next nerves that I'm going to test is the glossopharyngeal and the vagus nerve. So, Drew, can you stick out your tongue and say, ah? Okay? The uvula moved up and it was symmetrical inside the mouth, so everything appears to be good with the glossopharyngeal and vagus cranial nerves. So now that I'm done with the mouth, I'm going to do the ears. The first thing that I'm going to do is I am going to inspect his ears and palpate his pinna. Everything looks good there. His ears are symmetrical on his head and they are aligned correctly. And normally at this stage, I would use an otoscope to inspect the tympanic membrane, but I unfortunately do not have one of those at home, so I can't do that. Next thing I'm going to do is I'm going to look at his neck. I'm going to inspect his tracheal alignment. Everything looks good there. It goes right down the center of his neck and doesn't deviate. It's not crooked or anything. I'm now going to palpate the carotid arteries, each separately, for symmetry. Everything feels good there. They are symmetrical on both sides. Next thing I'm going to do is I am going to listen to each carotid artery separately with the bell, so I'm listening for bruits. And Drew, when I do this, will you hold your breath?
Yeah.
Everything sounds good there. There was no whooshing sounds or anything like that, so there are no bruits. So the last thing that I'm going to do with you, Drew, is I'm going to check all your lymph nodes. So the first lymph node that I'm checking is the occipital lymph node, which is behind the head, and then the post-auricular behind the ears, pre-auricular in front of the ears, submandibular under the jaw, and then submental under the chin. And then can you flex your shoulder supports for your clavicle? Supraclavicular, that is above the clavicle. I'm going to feel his cervical chain. Everything looks good there. So now I'm going to check my sheet to make sure I didn't miss anything. Okay, I think I'm all good there. So now I'm going to move to the back of him. So Drew, can I just spin around this way? Okay, so the first thing that I'm going to do is I'm going to palpate his thyroid. Can you swallow for me? Okay, everything looks good there. Drew, do you mind if I lift up your shirt probably up to here?
Yep, you're good.
Okay, so the first thing that I'm going to do is I'm going to inspect his skin. I'm going to note that it looks normal. I do see some freckles, but nothing abnormal about those freckles. They all look good. And then I'm going to have you take a deep breath, and I'm going to put my hands on his back to assess if his lungs expand equally. Deep breath. Okay? Both lungs expand equally when he takes a deep breath. The next thing that I'm going to do is I'm going to percuss in 6 spots on each side, so for 12 spots total on the lungs. Again, that was for 12 spots of percussion total. Next thing that I'm going to do is I'm going to auscultate his lung fields. This is with the diaphragm. Switch it around. Again, I'm doing this for 6 spots on each side, so that's 12 total. And Drew, when I tell you, just take a deep breath. Can you please do that?
Yeah.
Okay. Breathe. 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 How you doing with that? You doing good?
Yeah.
Okay. Breathe. 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 One more. Breathe. And breathe. Okay, everything sounds good there. I didn't hear any crackles or wheezes, so everything sounds normal. Again, that was for 12 spots totals of auscultation of the lung fields. So, that is good. Everything looks normal. Skin looks normal. Everything sounded normal when I percussed and listened to it, so the lungs are good. So the next thing that I'm going to have you do, Drew, is I'm going to have you lay down flat on the bed. I don't know if you can see that. With no pillow, please. Okay? Sorry. Okay. So the first thing that I'm going to assess is I'm going to look at his neck, and I'm going to look for jugular vein distension. So Drew, can you face towards the window for me, please? So there are no, oh my gosh, it's turning off. There are no bulges on his neck, so that is a good sign. Everything looks good there. The next thing that I'm going to do is I'm going to start the cardiovascular part of the exam, so I'm going to inspect his chest. Drew, is it okay if I pull down your shirt?
Yeah.
Everything looks normal there. Skin color is normal. There's not really any freckles there, so everything looks good. The next thing that I'm going to do is I'm going to listen to his heart. There are 5 spots, and I'm going to listen with the diaphragm and the bell on each spot. So, Drew, how would you prefer me to do this? Do you want me to go up or do you want me to go down?
You can go up.
Up? Okay. So right now I'm on the right side of the sternal border at the second intercostal space at the aortic, listening with the diaphragm. Diaphragm sounds good. Flipping over to bell. Bell also sounds good. There is no whooshing noises. Now I'm moving over to the left side of the sternal border, and I am in the second intercostal space again at the pulmonic, listening with the diaphragm. Diaphragm sounds good. Flipping it over to the bell. The bell also sounds good. Now I'm going to move down to the third intercostal space at the herbs, listening with the diaphragm. Diaphragm sounds good, switching to bell. The bell also sounds good. I'm now going to move down to the fourth intercostal space to the tricuspid. The diaphragm sounds good, flipping it to the bell. The bell sounds good as well. The last one is the fifth intercostal space at the midclavicular line, so that is the mitral bell, and I'm going to listen to his apical pulse there for a full minute. The apical pulse was 64, so it's a little higher than it was when I assessed his radial pulse. Flipping over to use the bell to assess for bruits. Everything also sounds good there. There was no whooshing noises or signs of a bruit, so all 5 spots sounded good with the diaphragm and with the bell. So everything is good there. Shoot, it keeps turning. The next part of the exam is the abdominal assessment. So Drew, is it okay if I lift up your shirt?
Yeah.
So the first thing that I'm going to do is I'm going to inspect the abdomen. I'm going to look for any lumps or anything that looks abnormal, any lesions, and everything looks good on Drew. The next part is the auscultation. So first I'm going to listen with the diaphragm, and I'm going to listen to his bowel sounds in the 4 quadrants, starting with the right lower quadrant and moving in the direction of the large intestine. Everything sounds good with his bowel sounds. I heard at least 5 in every quadrant before I moved on, and I just heard gurgling noises, so that is indicative of a bowel sound. So the next thing that I'm going to do is I'm going to auscultate his abdominal arteries. So there are 7 spots: the aortic, renal, and iliac. So I'm going to use that. I'm going to do that with the bell, and then I'm going to listen for bruits. I'm at the aortic. Everything sounds good there. I'm at the right renal. Everything also sounds good there. I'm at the left renal. Everything sounds good there. Right iliac. Everything sounds good there. And now I'm at the left iliac. Everything sounds good there. So that at each of the 7 spots, there was no whooshing noises, so there are no bruits. The third step in the abdominal assessment is the percussion. So I'm going to percuss in the 4 quadrants and up to the liver border. So Drew, I'm just going to do the same thing that I did on your back. Just tap with the fingers.
Okay.
Everything sounded normal there. When I got up to the liver, it made a dull sound, so that's good. The next thing that I'm going to do is I'm going to palpate. I'm going to start with light palpitation and then deep palpation, and I'm going to be looking for any lumps or masses that shouldn't be there inside of the abdomen. So first is light palpation. Just going to push a little bit down, Drew. Let me know if you have any pain. Everything feel okay?
Yep, we're good.
Okay, everything felt normal with the light palpation. Now for deep, I'm just going to push a little bit further. Let me know if you have any pain.
Nope.
Nope, okay. Everything felt good there. I felt no lumps or bumps or masses that shouldn't be there inside of his stomach. So while I have you down here, Drew, I'm going to palpate his femoral arteries for symmetry on both sides, and then I'm going to listen to them. So first, I'm going to palpate the left femoral artery. Good there. Everything is good with the left femoral artery. Now I'm going to palpate the right. The femoral arteries were equal on both sides, so they are symmetrical. They felt the same. Next, I'm going to auscultate with the bell side, so I'm looking for any bruits that might be occurring in his femoral artery. Left femoral artery sounds normal. There's no whooshing. The right femoral artery also sounds good. There was no whooshing noises, so no bruise. So now I'm going to look at my sheet to make sure that I didn't miss anything on that specific portion. Okay, Drew, what I'm going to have you do now is I'm going to have you sit up. Can you take off your shoes and your socks for me? It's really dark. Okay, so now I'm going to inspect his legs. I'm going to look to make sure that the skin looks normal and that the temperature is equal throughout both legs. And I'm going to look for any edema that there might be. And I'm also going to palpate some of the remaining pulses. So his toes look normal color. There's no sign of cyanosis. Capillary refill is also good down there. It's less than 2 seconds. Skin looks good. The temperature is equal throughout the legs. When I push on the skin, there is no sign for any edema. I'm now going to palpate the pulse behind the knee. The pulse behind the knee, yeah. That is equal. Now I'm going to do the posterior tibialis, which is behind the ankle bone. Those are equal and symmetrical. Now I'm going to do the dorsalis, which is on top of the foot. Those are also symmetrical. Again, so I palpated the popliteal, the posterior tibialis, and the dorsalis arteries for symmetry and both legs. They were all good. Next thing that I'm going to do, Drew, is I am going to do sharp and dull on you. So this is sharp. This is dull. And I'm either going to do it on your knee, your shin, or the bottom of your foot. So you're just going to tell me if it's sharp or dull and where it is located. Okay.
Sharp shin. Dull bottom of foot. Sharp knee.
Everything looks good there. So I am now going to check your reflexes. So can you... Okay, sorry. Now I'm going to check your reflexes. So I would normally do this with the hammer, but I don't have one of those at home. So I'm going to... Can you relax your legs for me? Okay. Both of his feet jumped, so everything looks good there. So Drew, I'm going to have you put on your shoes and your socks. Your socks and your shoes, sorry. So the next thing that I'm going to be testing for is his acoustic cranial nerve. So I'm going to do that with the Romberg test. He's going to stand up and close his eyes for 20 seconds, and I'm going to assess if there's any swaying or any imbalance there. Got your shoes on?
Yeah.
Okay, so Drew, you're going to close your eyes, and you're going to stand there for 20 seconds. Again, this is testing for the acoustic cranial nerve. Ready, go. Okay, you're good? There was no swaying present there. There was no swaying, so that is a negative Romberg test, so he is good to walk. Okay, the last thing that I'm going to have you do, Drew, is I'm going to have you do heel to toe. Can you see? Have you do walk heel to toe, heel to toe. I'm going to have you do it there and back. Good? Good, okay. everything looks good there, so I'm gonna have a seat. I have a couple more questions for you, and then we're all set. So the first thing that I'm gonna ask you, Drew, is how often would you exercise throughout the week?
Pretty much every day.
So what would that consist of? Like cardio, lifting, what?
A lot of cardio, some lifting.
Cardio. Would you say you have a pretty healthy diet?
Yeah.
You eat fruits and veggies?
Yeah.
When mom makes dinner, or your mom makes dinner, do you eat all of your meals?
Yep.
Okay. So I would give my patient a Braden score scale of 23. He is mobile, he exercises frequently, has a fairly healthy diet, and eats all of his meals. So thank you, Drew, for the help.
Thank you.
And we are done.